Welcome. Today, we embark on an insightful journey into the world of thiazide diuretics, a class of medications that have transformed the treatment of hypertension and fluid retention. We'll explore their mechanism of action, structure, more. By the end of this session, you'll have a deep understanding of how these drugs work and why they remain a cornerstone in modern medicine. Let's start with a simple question. What are they? Thiazide diuretics are a class of medications primarily used to manage hypertension, high blood pressure, and edema, fluid retention. But how do they work? These drugs inhibit sodium reabsorption in the distal convoluted tubules of the kidneys. As a result, more sodium and water are excreted in the urine. This process lowers blood pressure and reduces fluid buildup, making thiazide diuretics an essential treatment for many cardiovascular and renal conditions. Throughout this session, we will explore their mechanism of action, structure, uses, side effects, and more. So let's begin our journey into the world of thiazide diuretics. Let's take a step back in time to see where it all began. The first thiazide diuretic, chlorothiazide, was introduced in 1958, a groundbreaking moment in the treatment of hypertension. This revolutionary drug was developed by scientists at Merck and chlorthalidone. Over the years, these medications have become cornerstones in hypertension management, helping millions of patients worldwide. This discovery was a turning point in medicine, giving us safer and more effective ways to control company, who discovered its ability to promote sodium and water excretion, leading to effective blood pressure control. Chlorothiazide's success paved the way for the development of other thiazide and thiazide-like diuretics, such as hydrochlorothiazide, blood pressure, and reduce the risk of heart disease and stroke. Now, let's explore how these drugs actually work. 2. How do thiazide diuretics work? Mechanism of action. Thiazide diuretics work inside the kidneys, specifically in the distal convoluted tubule, where they block sodium, Na, and chloride, Cl reabsorption. Normally, the kidney reabsorbs sodium and chloride to maintain fluid balance. Thiazides inhibit this process, leading to increased excretion of sodium, chloride, and water through urine. This reduces blood volume, which helps lower blood pressure. Key-cap 2 increase potassium, K excretion. Since more sodium reaches the collecting duct, the kidney tries to balance electrolytes by excreting more potassium. This can lead to low potassium levels, hypokalemia. Unlike loop diuretics that increase calcium loss, thiazides help the body retain calcium by altering the sodium-calcium exchange. This makes them beneficial for patients with osteoporosis because they reduce calcium loss in urine. Now, let's talk about the structure-activity relationship, SAR, of thiazide diuretics. Thiazide diuretics are weak acids due to their benzothiadiazine 1,1-dioxide nucleus, which plays a key role in their pharmacological activity. The most acidic proton is found at the N2 position, mainly because of the strong electron withdrawing effect of the adjacent sulfone, SO2 group. There's also a sulfonamide, SO2NH2 group at C7, which is acidic too. Now, let's go over the essential modifications for diuretic activity. An electron withdrawing group at C6 enhances electron deficiency in the benzothiadiazine ring. This improves binding to the Na/Cl symporter, which is key to diuretic action. The best substituents at C6 are chloro-Cl and trifluoromethyl CF3, both of which lead to strong activity. CF3 has an additional advantage. It increases lipid solubility, resulting in a longer duration of action compared to Cl on the other hand. If hydrogen, H, is at C6, diuretic activity is minimal. Electron donating groups, CH3, OCH3, greatly reduce activity. The sulfonamide, SO2NH2 group at C7 is essential for activity. Why? It is required for hydrogen bonding with a Na/Cl symporter modification or removal of this group leads to a loss of activity. Example, all clinically used thiazides retain this group, such as hydrochlorothiazide chlorothiazide. The saturation of the C3/C4 double bond leads to a 10-fold increase in activity. Examples, hydrochlorothiazide, saturated C3/C4, more potent chlorothiazide. When we introduce a lipophilic group at the C3 position, we see a significant increase in potency and a prolonged duration of action. Now, why does this happen? Well, adding lipophilic group improves lipid solubility, which means the drug had a higher tendency to distribute into fatty tissues. As a result, renal clearance is reduced, and bioavailability is enhanced. So the drug stays in the body for a longer period, leading to prolonged action. A good example of this is bendroflumethiazide. Now, moving on to alkyl substitution at N2. This modification primarily affects the half-life of the drug. By introducing an alkyl group at the N2 position, we decrease polarity. And what does that mean for elimination? Lower polarity reduces renal excretion, so the drug isn't cleared as quickly from the body. This directly translates to an extended half-life and a longer duration of action. A great example here is polythiazide. Modifications that reduce or eliminate activity, removing or altering sulfonamide, SO2NH2, at C7 effect, abolishes activity. Why? Disrupts hydrogen bonding, preventing interaction with the sodium chloride transporter. Example, no clinically used thiazides lack this group. Replacing chloride. CF3 at C6 with electron-donating groups, CH3, OCH3, effect, reduces activity significantly. Why? Decreases electron deficiency, weakening the drug's binding to its target. Keeping an unsaturated C3-C4 bond effect, decreases potency tenfold. Why? Reduces flexibility, lowering binding affinity. Example, chlorothiazide, unsaturated, is much weaker than hydrochlorothiazide. Thiazide diuretics are widely used medications with several important clinical indications. Let's explore their key uses. Thiazide diuretics are considered first-line therapy for most patients with hypertension. They effectively lower blood pressure and reduce the risk of cardiovascular events such as stroke and heart failure. These medications are also used to treat edema. By increasing sodium and water excretion, they help reduce fluid buildup in the body. Thiazide diuretics can be beneficial in nephrogenic diabetes insipidus, a rare condition where the kidneys fail to concentrate urine, leading to excessive urination and dehydration. They also play a role in preventing calcium-based kidney stones by decreasing the amount of calcium excreted in the urine, reducing the likelihood of stone formation. Side effects. Number 1. Hypokalemia. Thiazides enhance potassium excretion in the urine. Number 2. Hyperuricemia and increased gout risk. These drugs reduce uric acid excretion, leading to elevated serum uric acid levels. Number 3. Dehydration and hypotension due to their diuretic effect and excessive fluid loss. Number 4. Electrolyte imbalances. In addition to potassium loss, thiazides cause hyponatremia, hypomagnesemia, and hypercalcemia, lead to neurovascular and cardiovascular disturbances. Number 5. Hyperglycemia. Thiazides can impair glucose metabolism by decreasing insulin sensitivity, which may worsen glycemic control in diabetic patients. Thiazide diuretics contraindication. Number 1. Uncontrolled diabetes mellitus. Number 2. Severe renal impairment. Number 3. Impaired hepatic function. Number 4. Hypersensitivity to sulfonamide. Number 5. Gout. Finally, let's talk about the administration of thiazide diuretics. Thiazides are often prescribed for long-term management of conditions like hypertension. Because of this, regular monitoring of electrolyte levels is important. When using thiazides to treat hypertension, the typical starting dose is around 25 mg daily. This can be increased as needed, up to 50 to 100 mg per day, depending on the patient's response. For edema, the starting dose is generally higher, around 50 to 100 mg. Again, this can be adjusted upwards, sometimes reaching 200 mg, depending on the specific thiazide drug being used and the individual patient's needs. Regardless of the condition being treated, thiazides are typically taken orally, usually once a day in the morning, and it's generally recommended to take them with food. Now, let's get ready to smash this quiz.
And now, the moment you've all been waiting for. The answers. This video was brought to you by. That's a wrap. Thank you so much for watching.